Hi, and welcome to the fourth episode of Kinston Community Health Center's KCHC podcast, KCHC Pulse. I am your host this morning. My name is Anna Kinsey, and I'm here with Katherine Andersen. Katherine, thank you so much for joining us.
Thanks for having me. It's exciting.
In preparation of you coming, I was thinking about how our conversation was going to go and not wanting to miss anything important this morning because you're a wealth of information about our topic today. And what came to my mind was thinking about individuals that they say that they are an expert in something, and you hear organizations talking or claiming that they're the best. I don't think that is true. I mean, I don't know how you feel, but I always wondered, why do you say that? Because there's so much more that you can learn. Mm-hmm. Everybody's learning.
Oh yeah.
So I think organizations, when they realize that, they'll call in a consultant, or with roles inside of a community health center or any organization, they'll call in a practice support coach. Mm-hmm. And that is what you are.
I am.
And that's why I invited you this morning
to
come and talk with us. So tell us a little bit about yourself.
So yes, I'm a practice support coach with SEAHEC, which is Southeast AHEC, part of North Carolina AHEC. I'm in Wilmington, so I cover just our region of 5 counties around Wilmington, New Hanover County. And I work in practice support. We just work with independent practices that are not system owned, with rural health centers, community health centers, on just whatever they might need, whatever is going to help them succeed and not, in this move to a value-based world, whatever they need. We meet a practice where they are, and with incentives or government programs, whatever it is, and we help them with.
And you've been
anything.
Doing this for 6 years, right?
I have been, yes.
Okay.
I came from a health department background and then moved into practice support, yes.
All right. Well, the funny thing about today is our meeting, our conversation. This is the first time that I've actually met you in person. We have talked so many times over the phone and met so many times virtually. This is the first time in person.
I know, it's exciting. I love being here in person.
That's the thing now. Everybody has meetings virtually, but it's so nice to meet someone in person.
Definitely.
So I'm glad to really meet you and be able to talk to you today.
Me too. It's about time.
I think that what's important to tell everybody too is how we met. I was on a meeting with the North Carolina Community Health Center Association, mm-hmm. and their focus was talking about a pilot and for community health workers, mm-hmm. and the integration in their practice. And they were asking for those to participate in the pilot. Well, I always ask for guidance, always. I never turn guidance away. And so said yes, because we do have a community outreach department here, and mm-hmm. it's been established since 2005. And that's how I met you. Uh-huh. You became our coach. Right.
In addition to my practice support role, I work with the community health worker coaching role as well, statewide, part of SEAHEC as well. And and so that piece, that coaching piece for community health workers is definitely how we met.
Is it challenging for you when you're working with different community health centers and trying to help them with their flow, especially when it comes to community health workers? Mm-hmm. Is it challenging?
It is. Everyone is different. Every practice, every community health center is different, has different staff, populations, needs. So you just have to tailor it to the practice or to the community health center and where you are, and that's where we come to help.
I think of you, when you were describing that, I think of you as a part community health worker too.
Oh, I wouldn't give myself, no, I wish I could say that. Community health workers are amazing, and I wouldn't even want to give myself that title because I don't deserve it. They do all the amazing work, and I just kind of try to help and lead in any way that I can, but they do the most wonderful work. So
you are absolutely right. I will have to agree with you on that. You are absolutely right. And the community health workers, it's amazing how their resiliency is. Mm-hmm. Because in that role, you do have to be resilient, and they are tackling the social determinants of our patients. those social determinants can affect their health and well-being.
Very much.
And that can be stressful in itself.
Very much. And that's a huge part of it. Probably the biggest part of it is addressing the social needs. And we're finally realizing, after way too much time, just how much your social needs and just your surroundings can influence your health. And that's what the community health workers can really help with. They understand the health system as well, but also the community and the social needs that the patient's going through. It can help them deal with that.
Well, I'm glad you brought that up, because with what you're doing, what impacts have you seen community health makers make in their community and in their organization where they work?
So much. At the individual basis, it's meeting that patient where they are and helping them address the needs that they didn't know that they could address. They don't even know where to start, but the community health workers can help them meet those needs, get resources, get to appointments, whatever it might be. And so then it turns into better health outcomes. It's a healthier person because they can come to their appointments, or they can get their medications, or they have enough food on the table. It's these things that people don't always think about that affect their health. And so even just affecting one person and making them healthier, or a healthier family, is a huge win. And then at the system level, just making physicians, nurses, everyone understand that it's a social problem. It's more than just they come to the appointment, I give them a prescription, they leave, and it's so much more than that. And the community health workers help everyone realize that.
Right. I often wonder when I hear folks say, these patients are being non-compliant. I keep seeing these patients every month or every 3 months, and they're being non-compliant. Well, why is that?
Right.
But they really don't ask the patient, why is that?
Right.
Katherine, why is it that you don't keep your appointments? Or why is it that your blood sugars are so high all the time? And, nothing against that, but maybe we need to delve into it a little bit, and that's where the community health workers come in. Because community health workers, I know when I first met you or first talked to you, you said we were going through a checklist. Because you were listening to the existing flow of the community outreach department, and then we looked at things that maybe we could do different, maybe we could implement into the center to make awareness that community health centers' work is very important. And so if a provider doesn't talk to or even have a resource like a community health worker, they won't know why the patients can be non-compliant, right?
Right. It's often just labeled non-compliant. They didn't take their medications. They didn't come to their appointment, or they're not exercising, or whatever it might be that the care plan, that the provider decides for the care plan. But it could be, you just have to ask why. Why aren't you coming to appointments? Well, I don't have a car. There's not a bus stop near me, or there's not sidewalks to be able to walk here, or I can't afford my medications, or my medication needs to be refrigerated. I don't have a refrigerator. All those things are so prevalent, and people just don't even realize it. And the people are scared. The people that are dealing with this are often scared to speak up. They aren't advocates for themselves because they're nervous they'll get in trouble, or there's judgment around it, to be honest.
Right.
And so understanding to ask why in the first place can get to the heart of the matter, and then, we can help you fix that. Even if it's something very small, a food box, something can change everything. And then they're not labeled non-compliant. And unfortunately, that's the go-to label until we understand the why.
Exactly. And, I think community health centers have done a wonderful job in showing the importance of community health workers.
Right.
And you work with our North Carolina Association.
We do, through this coaching project. We do.
So do you feel the same way that I do, in that they are really focusing on the importance of the role of community health centers?
Oh, definitely. The community health centers are where the community health workers are. You guys are the safety net providers that are here for the community, and you're the go-to where everyone feels safe to come to. And so you guys are ahead of the game, I would think, with community health workers, with just understanding your community and being there for them, for sure.
You and I talked earlier, we were talking about our behavioral health unit and how we moved them down to our parent site or our main site. And that's because, you talk about delivering integrated holistic care. And well, we weren't integrated with our behavioral health down the road.
Right.
So we moved them in, and the focus is having teams to work with providers. And what I think is important is to include a community health worker with that provider team because they can address the social determinants. So we're getting there. That's one of the things in the pilot, that you and I talked about, was, having that integration happen. We have some providers in here that, people in the community outreach department they're their go-to folks. They go and talk to them and want them to go see patients in their homes and things. But I don't think everybody is on board yet. And I don't think it applies only to Kinston Community Health Center.
Definitely not.
And it takes a team, right? It takes a team, especially when you're addressing the patient's issues that they're facing. So what do you suggest as a practice support coach for folks like that, or individuals?
Well, I would say it's all about education, understanding what a community health worker does, that they are in your clinic, their role, and really understanding it. I think it's just not known. Community health workers have been around and maybe called different things for many, many years. But getting the providers to know what they actually do, what their value is, how they work in the community, that they understand the community, are from the community. So they have a very different trusting relationship with patients. So if a provider has a challenge with a patient, the community health workers often can be the go-to person. And it does take a team. It can be the nurse's perspective, the behavioral health therapist perspective, and then talking to the community health worker about how they can help meet the needs from every direction.
One of the things that I think is really important to note is that there have been conversations for years about community health workers being certified, because I think that puts the back on what they do.
Right.
Because sometimes they're looked at as folks who have no education,
right,
no experience. So why would a provider feel comfortable in going to a community health worker? Well, you told me from the very beginning, it is important to have folks who have lived experience, because that is how they make an impact, because they know. So tell me a little bit about that.
That lived experience is the game changer. They've been there where the patient is now. They've had to navigate the health system, or they've been on Medicaid, or they've been without food, or they've been homeless. That lived experience gives them a completely different perspective, so they can relate to the patient, have a trusting relationship with the patient, understand where they are, and then where to go, and how to come out of whatever they're going through, or just to navigate it. Even just the health system in general and insurance, it's confusing for anyone.
Absolutely.
But especially someone that may be dealing with some challenging social needs, and so they need help, and that person, the community health worker, has been there and can help them through it.
Yeah, I think, trust.
Big, huge.
That is a huge factor in making an impact in somebody's life, especially when you are focusing on their health. If they don't trust you, they're not going to tell you what's going on with you. I mean, we have folks that will drive patients to their appointments, and it's amazing when they come back and they tell me, oh, well, Miss Smith told me all of this that's going on, and this is happening with her family. And I immediately turn around and look at them and say, you know what? You need to go tell the provider. This is something that you need to share with the provider.
Right.
And they do. And that in itself was just a small step when I made that decision to tell them, go tell your provider. And that was a couple years ago.
Because they're not opening up to the provider in that way. Maybe some people do, but for the most part, people can be intimidated by providers. And it's understandable. And and they just need to be able to say what they need to say to someone that they trust. And so, but the provider needs to know that, just for whatever they can, get it from, they need to know that, because it will help them completely inform their care plan. It might change everything for them. Oh, if I'd only known that, I would have done this medication instead. Or, I would have understood why they missed their appointment, and maybe I can do a telehealth appointment next time. Whatever it might be, they just need to know. It's all about communication.
Exactly right. And I was thinking about a couple years ago, well, it's actually been several years ago, and you may remember this too, but there was a big push for telling patients, okay, this is the questions, these are the questions that you ask. Write down your questions.
Right.
Write down all your medicines. And don't leave that exam room if you still have questions.
Right.
Make sure that you're asking. But you're absolutely right. It's the white coat syndrome.
Right.
They're not comfortable. If they're just meeting the doctor for the first time, or maybe even for a second or third time, they're not comfortable yet.
Yeah.
They're not going to say anything to them.
Right.
So that community health worker can relay that information, whether it be a driver or whoever.
The providers, they have a limited amount of time. They might have all the good intentions of the world. They would probably love to sit and talk with their patients for an hour, but we have to be realistic that they might not be able to.
That's
so
right.
Even that piece, even with a wonderful provider that would love to meet those social needs in that moment, they have to rely on the community health worker for that time and the trusted conversation as well, just for time's sake.
Right, that's exactly right. And I brought up, I was talking about the driver, but a community health worker can actually have a whole lot of more different or more broad titles. So tell me some of them that you've heard.
Oh, patient navigator is a big one. Patient advocate. Not that it all means the same thing necessarily. The community health workers can be a certified title, but anyone that in patient outreach, anyone that is working with those patients and connected to the community to serve the patients, to help them, is what a community health worker does.
Right.
And there's so many, over the years, before it was an official title, people were doing this work even without a name. It was someone in the community, oh, you need to go to this person because they can help you. That was community health work, and we didn't even know it. So
Right.
Very historic.
The stories that you read about community health centers, about community health workers in community health centers from way back when.
Oh, yes.
When they had the first community health center, and they said exactly what you said. They said they were community health workers years ago.
Oh, right.
Why are we just now calling them community health workers?
Right.
This has been done for years.
Right. And going back to what you said about needing that certification, it is something that people respect, and it can empower the community health worker to feel like they went through that program. There's a lot of reasons that it's a wonderful program, but it doesn't necessarily mean you can't do the work without a certification. I mean, that kind of is a policy depending on the practice or the clinic, because community health workers can just have hours and hours and hours of experience, and that still makes them a community health worker.
Right,
So.
right. For me, I have wanted to have an avenue to get folks certified for a very long time, because I just don't think that community health workers are looked at as important as, say, a nurse or a doctor or something like that. And for some reason, you have certification, that you are it.
Right.
You can do, be all, do all because you have certification.
Right.
But that's where that lived experience that you and I talked about so many times comes in. It doesn't take certification to make you a good community health worker.
Right.
But in the past couple of years, I think other folks are seeing the role as important too, because Medicare now is reimbursing for...
That's a big win.
Yes, let's talk about that, because that's exciting.
Right, and it's still very new, and
Yes.
I can't, not a lot of people are able to use the codes yet, but yes, Medicare on their newest fee schedule added community health integration codes, the CHI codes, and so that is for, even in the verbiage, it lists community health workers able to do those codes for the time that they spend with patients. And it's with the goal of advancing the provider's care plan by meeting those social needs, providing resources, whatever it takes to achieve the care plan is you can now bill for. Just for Medicare, though. Hopefully that will grow to
Hopefully
other
it's gonna
payers.
change.
Yes, fingers crossed.
And, you know, I just recently went to a conference and they were talking about Medicaid, you know, all the things going on right now with Medicaid. But the most positive point that I took back, that I brought back, was that, you know, Medicaid is looking at reimbursing for community health workers' roles and what they do.
I hope so.
Oh my gosh, Catherine, me
I mean,
too.
That is such often a vulnerable population that needs community health workers so much, and it would be a game changer for them to have that opportunity. And the more billing we can do, the more community health workers that can be hired, and the more work can be done. It's just will, you know, grow into better health outcomes overall, which is the whole goal.
That's right.
Yeah.
I don't know about anybody else, but when I saw that, the first time I saw the information come out about the codes for Medicare and reimbursement, I mean, I was jumping up and down, and I went and told the staff, I said, look what's happening.
We're getting there.
Yes.
We're getting there.
Baby steps, but this is a big hill that we just went over.
And we went to Medicaid managed care, you know, a few years ago, and they did, it's not billable yet, but they did talk about or emphasize the focus on community health workers and the mission for community health workers and the value. So they're acknowledged, just can't pay for them yet, but so maybe that was the first step with Medicaid, acknowledging the importance, those prepaid health plans, they have it in you know, that they support community health workers, but we just need that to be financial support eventually.
Oh,
so
yes,
they do have it
absolutely.
in their mission, so that's a good step.
And then you bring that up, that we do need reimbursement for the roles of a community health center and the services that they deliver, and one of those is transportation. You know, transportation is a huge issue for most community health centers. Well, I think it would be fair to say for probably all community health centers.
Probably.
Transportation is an issue. And recently I was in a conversation with Behavioral Health Grant about a behavioral health grant, and they actually were reimbursing transportation services provided to those who needed to come into the center for MAT services.
That's great.
So, you know, that's a step too.
Medicaid does have transportation as well, but it has its, you know, its barriers and for everyone. It's not. So there's talks of different ways using Uber, Lyft. There's different ways to do it. You almost have to get creative, but also it's the patient knowing that these exist. That's part of it too. So they need an advocate at the community health center to tell them about these services. Otherwise, they just don't know, and they don't know to look out for anything. They don't know what's there.
That's exactly right. And I was just thinking, now the certification is completed by the individual through what organization?
Well, it's through the North Carolina community colleges. There's several around the state that offer the certification. So that's one route. That's kind of the more, I would say, traditional route, I guess, to get the certification. But also, in the recent years, they've realized just how much work is being done for community health workers that have been doing this for hundreds, thousands of hours, you know, for several years. And they started a legacy track through the Community Health Worker Association. So with the amount of time, you can take some supplemental classes and do a legacy track. So there's different options, recognizing people have been doing this for so long. They have so much experience. Just because they weren't in the classroom doesn't mean they can't be certified.
Right.
So there's a couple of different tracks. There's more and more opportunities, and it's growing. But there's several across the state, the community colleges backed by DHHS to get certification programs.
And I think the North Carolina Community Health Workers Association is actually getting ready to have a big summit in New Bern, aren't they?
Yes, they are. I'll be there.
Yay! I'm going too.
Good.
I'm going to go too.
I'm excited.
And other staff here from KCHC Community Health Center are going too.
Good. Yes.
So I'm ready to learn.
It's exciting. I've been to one other, and then this one's in New Bern, April 2nd and 3rd. And it's the most inspiring event. I mean, just hearing stories. I just like to sit back and listen to the people telling stories, because so much community health work is anecdotal, and to hear that is just inspiring, the work that people are doing. It's great.
Well,
I'm excited.
That's why you started volunteering at the hospital, right?
Right.
Yeah, because you just love to hear people's stories.
I do. People just want to be heard, and they just need an advocate sometimes. And it's great it's a privilege to do that role.
How can we make an impact if we don't listen?
Right.
We
first
have to
step.
listen.
Right.
You're right. That's the absolute first step. So I wonder how easy it may have been for others, and this is getting back to the teams, because, you know, inner department teams have to collaborate. That's important.
Definitely.
So what are some challenges that you've seen in other community health centers, and even in, I mean, you can talk about us, that's fine, whatever you like to do, but what are some challenges to have that happen?
Well, just changing to that culture. It's a culture of a center to have that, to be transparent, to all work together. A lot of, I don't know if you guys specifically, but a lot of clinics work in silos, and the nurses, you know, maybe meet with, you know, with their MAs, but bringing in everyone and having a team for a patient, it makes it more efficient. It's, instead of having to go to this person and this person, it's better for the patient, it's better for the staff when everyone, I always encourage those huddles in the morning where, you know, going through a patient or a daily schedule, talking about each patient, what they might need, so everyone's prepared. And you're working as a team, okay, what does this patient need today? And everyone's right there listening, we need this from you, we need this from you. And it just makes it flow better, and it gives the patient better care, and everyone just feels like they're on the same page and they know how to help this patient.
Right. And your guidance, you know, like I said at the very beginning, nobody's an expert.
No.
Nobody knows everything.
I'm not either. I will never claim to be
knows
an
everything.
expert.
But your guidance has helped with the flow, because we actually implemented somebody from our community outreach department to be included in huddles.
Right.
And, you know, now I'm sure folks will look and they'll say, okay, well, where's community outreach representation? Right. You know, if we have to go to an event in the community or whatever. But then, you know, we implemented that. We implemented stories on our patient newsletter or in our inner newsletter. We did that. We've done a lot of things, Katherine, since you and I have met.
You have done that. You and your team have done that. You guys have such passion for it, and you guys hit the ground running, and it was so wonderful.
Well, thank you very much. So I will recommend you to anybody.
Well, thanks.
when they ask questions about that, because the things that we've implemented under your guidance and your instruction have really made a difference. So,
that's great. That's
wonderful. I'm excited about that.
And we have a coaching team statewide. So I have a counterpart in every county is covered in North Carolina. Maybe not one placed in every county, but represented for each region. So anyone that needs help can get it from a coach through practice support and through the community health worker coaching.
Well, that's good to know. Maybe on the podcast we'll need to, you know, put some blurb on the bottom or something like that in case somebody wants to contact you guys.
Definitely. We're here to help optimize a program. We're just excited that anyone employs or even contracts with community health workers. They're not always employed by a center, but they might be a community-based organization, and they contract with different centers. There's plenty of places that do that as well, but all doing the same work, all with the mission of the patient. So we're just here to help in any way that we can.
Well, I told you about our mobile unit, right? Our mobile medical unit? Okay.
Yes.
Well, you know, we're talking about collaboration, inter department collaboration, and the folks here at the Community Health Center have been really great working with us, because, I mean, putting a mobile unit and getting it up and running, it takes a team. And you were spot on earlier when you said a lot of clinics that I see are siloed. We used to be that way. We used to be very siloed. But I will tell you that it's been a lot of work with a lot of different folks over the years. But I think the team that we have in the whole center right now is really a good, strong team, because when you're looking at taking the community health workers out there on the mobile unit with a provider for the first time, or with a provider's team for the first time, you know, that's scary for everybody. Is she going to do something right? Is this one going to do something wrong? Or how do we do this? Where are we going to do? So it's a lot of organization, a lot of collaboration, and we're working on that. That's getting stronger here.
That's
and
great.
I think it's great.
That's definitely, I mean, they're community health workers. You guys are part of the community health center.
Community
so go
health
out in
center.
The community. Like, you have to get out in the community, take your services to them. I mean, that's how you reach people sometimes, you know, and that's what, I think that's wonderful.
We have we have gotten to where we actually are able to take the mobile unit out once a month. So we have a provider, our practice manager, she schedules a provider once a month to go out with a mobile health unit. And we're trying to do that on a consistent basis and going to the same locations. And we are hoping that we can increase that. I know that there's some funding opportunities that we're pursuing, trying to get the mobile unit to go out, every week, and to plan that. You have to look at everybody and know their importance.
Right.
You have to look at a community health worker and know that their importance. Look at an RN and know their importance. Look at the driver and know their importance.
Right.
It all matters.
Oh,
right?
yeah, everyone has a place and is valuable. Can't do it without everyone.
Right.
Are they volunteer doing that? Do you have a team, or is it a new, almost like a new clinic room?
Yes, and I will tell you, this has been my nemesis for a long time, because just trying to get it up and running has been just a bear, to be honest with you. That's why I say the team that we have now, as a whole, in the center, has made it so much easier. But everybody is staffed from here, so they actually are taking the provider from here, putting the provider on the mobile unit, and going out into rural communities to see patients.
That's wonderful.
We have one provider, his name is Dr. Valdivia. He has a lot of patients in counties outside of Wayne and in Wayne counties. And so we chose a location in right outside of Wayne County at a church to set the mobile unit up, because a lot of his patients do have issues with transportation.
Yeah.
And so we want to be accessible to them, and they only want to see Dr. Valdivia. So we're trying to make it easier for them.
That's great.
And then we're trying to find, last year we went out to locations, the community health workers. I do have a registered nurse and a registered medical assistant and health educators on the team. And we were able to go out with the mobile unit, but we were doing screenings only. We didn't have a provider, but we were able to partner with local community-based organizations like Prevent Blindness or our local hospital. We had UNC Lenore, they came out and they did screenings. Prevent Blindness did screenings. So we had to think of a way to go out there and make an impact without a provider.
Right. Which you did, and which you can do.
Which we did,
for sure.
and we can do. And what I'm leading to is to be an employee of a community health center. You have to be adaptable. You have to be flexible. For community health centers, I think that being resilient is one trait, one skill that is very important for them.
I would agree.
What are some other skills that you think that they need to have?
Resilience is huge. Adaptability, open-mindedness, empathy. People are going through a lot. I think that's huge. I think we could everyone should be empathetic, but especially at a community health center when people are coming in with hard cases sometimes, and you have to be willing to help meet their needs, but be empathetic to that's the only way that you can get to people and to help them, is to truly understand them and be empathetic and willing to help them.
I think that is spot on. And let's go back to resiliency. Why do they have to be resilient?
Because you guys see it all. I mean, that's what I think. You see it all. You're pushed to your brink probably sometimes, because being empathetic, you're probably taking on the needs of some of these populations and some of these patients. Some come in and sometimes not great stories and some very challenging, scary stories that people are dealing with. And you have to help them be empathetic and also try not to take that home every night. And so you have to get through that. I mean, I think that resiliency, to come back the next day knowing you might face that again, and that can be an emotional and mental challenge for healthcare workers, big time, especially in a community center. that resiliency is very important.
Because it's all different walks of life.
Oh, yes.
Different backgrounds, different cultures. The
And
patients come in.
Right, cultures, languages, you're going to hit, those barriers. You never know what might come in, because you guys are the trusted healthcare source in a community. So everyone's going to come to you and need your services and need your help. So you have to be ready, whatever comes.
Yeah.
And respect it and offer them the same respect and trust and service that anyone would get. Everyone should be treated equitably, and that's hard on a person.
It's very hard. I remember when I actually heard somebody, I was at a meeting and I actually heard somebody talking about, the folks in the hood, or, I'd never go out and work with the homeless folks.
Yeah.
And I looked at them and I was like, you are in public health. You are in a role where you are not supposed to judge.
Right.
Whatever the background is of that individual, you're supposed to be there to help them, to guide them.
Right.
To improve their health.
Mm-hmm.
And it just, people are still learning.
People are learning.
People are still learning.
We need to give grace to that. Everyone's learning.
I know.
And
I try to.
Right. I know it's hard sometimes.
I try.
And we all, have our challenges and stuff. And but I think that's a big barrier for people. But it's all education and just realizing everyone's the same. Everyone just wants to live a healthy life. And
Right.
they just have different challenges to get there. But no one wants to be homeless. No one wants to have challenges in their health care and in their social needs,
Right.
but they're just doing the best they can. And you guys are just here to help them.
Right. Exactly.
That's all it is. Everyone's just human trying to do the best they can.
And I think for folks like you and I, because we're passionate about what we do, and when we witness that, we just want to jump over the table.
Right. It seems so obvious to us, but you're right. We're in this every day. You much so more than me. I want to make that clear. Yeah, so we see it and we understand it, but not everyone does. And we have to also give kind of grace to that, and that everyone, even healthcare workers that maybe have worked in a private office for so long and don't see certain types of the community, they're doing the best they can as well. And so that at least they're here working.
Okay, Katherine, when you leave, I'm going to remember you saying, okay, Anna, we need to give grace to that. So when things happen, I'm going to say, okay, Katherine said we need to give grace.
I didn't say it's easy to do. I just said we need to. We all need to do better.
Yes, we do. We all need to do better. We all need to do better. And I tell you, I'll watch some of the folks. I mean, there are folks in here that don't even know that I look at them sometimes, and I look at them as a community health worker and what they do. Mm-hmm.
I bet.
It really is. There's a young lady she's a supervisor over front desk, over medical records, over call center, and I don't know what else. Anyway, but she's a gem. And I look at her as a community health worker because she has addressed a lot of issues with our patients, and those issues are stemming from the social determinants that they face.
Mm-hmm. And I think it's important to note that it can be kind of discovered anywhere. I mean, the Healthy Opportunities pilot, that's something that's statewide, the Healthy Opportunities program, they have a no wrong door approach. There's no wrong way to get help. So even if someone's sitting up at the front desk, just overhears a conversation in the lobby that someone says they don't have food, or they're just, whatever it might be, get them help. Connect them to a community health worker. It doesn't have to be a doctor referral or a very formal way. It can be any way. Someone just overhearing that someone needs help, that's getting to the community health work. And I think that's important too, that everyone needs to be educated on what community health workers do, on what patients are facing within their community, so that we can help meet their needs wherever it comes up, wherever they all of a sudden feel comfortable saying it out loud.
That is absolutely right. And I hate that our conversation is almost coming to an end, so I do want to get this question. I know, aren't we having fun? I love it. But I do want to ask you the question about the role of a community health worker. Mm-hmm. How do you see that role expand as we move forward, just because of the little baby steps that have happened so far? How do you see that role expand in the future?
Well, I would say, funding wise, I would love to see it be a billable service so that we can have more community health workers. But a real true community health worker is in their community, and their job scope is huge. It's almost hard to even define what a community health worker does because it can change day to day. So I hope that community health workers continue to be very in tune to their community and their patients and have that lived experience. But also the number and of community health workers, and even more outside of community health work, understanding. I think that's where the big growth can be, is
Yes.
others understanding the value of community health workers and how much they can help in a center, because they know. It's preaching to the choir when you're here at a community health center or talking to other community health workers, but it's everyone else needs to know and have that education and just understand the barriers that patients are facing and how community health workers can help them. So that's the real growth, is the understanding outside of the people doing the work, I think.
I think you nailed it. I think you nailed it with your response. And
I hope so.
well, a lot of times others might look at the community health workers as kind of like the black sheep of the family.
Mm-hmm.
They're always out of the center. What are they doing? What are they doing when they're out of the center?
They're
Why
in the
are they,
community.
what are they doing?
Right.
They're never here.
That's a good point.
So
That's a
I
good
think
point.
that we are going to end with that. I think
Wonderful.
it's knowledge that people have to have about the role and support that community health workers provide.
Exactly. Spread the word.
That's exactly right. Katherine, thank you so much for being with me today. I have enjoyed it, and I
too.
knew that we were going to have a good conversation. I told you it was going to be easy.
I know.
We're passionate about what we do.
We are.
And
A lot of people are.
Yes.
So there's a lot of wonderful advocates and community health worker allies out there across the state, and the work continues.
Yes. And let's get some folks back and do patient stories.
Oh, that'd be great. Love
Or,
that.
whether they be good, bad, or ugly.
There's a
from
lot of all
community
of
health
it.
workers.
Right,
Exactly. We need to hear it all, right?
Definitely.
If if people are going to learn, they need to learn it all.
Yes. Yes, definitely.
Katherine, it has been my pleasure to
Thank
talk with you this
you.
morning, and thank you so much for driving from Wilmington
Yes, I
in the
loved
fog,
It was
coming
fun.
here.
It's a beautiful, beautiful countryside to drive through, so I was happy to do it. Thanks for having me.
Yes.
I appreciate it.
Thank you, Katherine, and thank you so much for joining us today. And come back and join us for the 5th episode of KCHC Pulse. Have a good day.